Many women believe that if they don't have sex for a long time, something bad can happen to their body, especially to their vagina. Some people even think it can close, shrink, or become unhealthy. But is that actually true? Today, we're going to look at what really happens to your body when you go without sex, from a scientific and medical perspective. We'll talk about the physical changes, the possible benefits, the possible downsides, and the biggest myths. First, it's important to understand something very simple. The vagina is a highly elastic and adaptable muscle. It does not permanently close or shrink if you stop having sex. If a woman goes months, or even years, without sexual activity, the structure of the vagina does not change in a harmful way. However, there are a few subtle things that can happen. Sexual activity increases blood flow to the pelvic area. If there is no sexual stimulation for a long time, that blood flow stimulation simply happens less often. But this is not dangerous. Hormones also play a key role. In younger women with stable estrogen levels, there is usually very little physical change. But in women approaching menopause, lower estrogen combined with no sexual activity can sometimes increase vaginal dryness. This is hormonal, not because the vagina is damaged. The female body adapts based on hormones, age, and overall health, not simply on sexual frequency. Now let's talk about possible positive effects. First, a lower risk of sexually transmitted infections. Abstinence completely removes that risk. Second, less friction and irritation. Some women who experience sensitivity or recurring irritation may actually feel more physically comfortable during periods without sex. Third, emotional clarity. For some women, taking a break from sexual activity can help them reconnect with their bodies and focus on mental well-being. And finally, the vaginal microbiome, the natural balance of bacteria, may remain very stable without exposure to new partners. In many cases, nothing negative happens at all. However, there can be some downsides depending on the individual. Some women may experience temporary changes in sensitivity when they resume sexual activity after a long period. Others may notice decreased natural lubrication, especially if estrogen levels are already low. There can also be psychological effects, such as frustration, increased stress, or feeling disconnected from intimacy. It's important to understand that these effects are not universal, and they are not dangerous. They are influenced by hormones, age, emotional health, and overall well-being. Let's clear up some common myths. Myth number 1. The vagina closes if you don't use it. False. It is a muscle designed to stretch and adapt. Myth number 2. It becomes unhealthy without sex. False. Sexual activity is not required for vaginal health. Myth number 3. You lose your ability permanently. Also false. The female body is resilient and adaptable throughout life. So, is it bad to go without sex? From a medical perspective, no, it is not harmful. Your body is designed to adapt, and vaginal health depends much more on hormones, overall health, and lifestyle than on sexual frequency. If you found this video helpful, don't forget to like and subscribe for more women's health and wellness content.